are. Tonight now in medical rounds, doctors at Hartford Hospital have a new non-invasive diagnostic tool they're using on patients with chronic liver disease. This tool is called FibroScan, and the Comprehensive Liver Center at Hartford Hospital is the only facility in Connecticut to have it. Joining us live now to explain more is Dr. Michael Einsterin, a gastroenterologist at Hartford Hospital. It's nice to see you, Dr. Einstein.
Thanks for having me, Denise. Good to be here.
Thank you. Well, tell us about FibroScan. How does it work?
FibroScan is a non-invasive tool. It's much like an ultrasound that we use to replace liver biopsy in the majority of patients. It's very easy. The patient comes in for their regular visit. They lay down on a stretcher and they put their arm over their head, and using gel like we use with an ultrasound machine, we put a probe on their side and we're able to tell within a few minutes how much scar tissue and liver damage there is in their liver.
That does sound easy. How does that compare to what the current method of diagnosis is?
Currently, we have liver biopsy as a way to tell how much scar tissue there is in a person. The downsides to liver biopsy: it's invasive, it can be painful, patients can bleed from it, though that's a rare complication, and the results typically take a few days to come back. This replaces that in the majority of people, and we can talk about the results right there in the office.
Boy, that does sound promising. It sort of sounds, though, like an ultrasound. Can it take the place of a typical ultrasound scan?
It's a little different than ultrasound, and we will use it complementary to ultrasound. An ultrasound will give us a global picture of the liver. It can pick up masses or subtle problems within it, but the FibroScan we use to look for actual scar tissue, which no other imaging modality can do. So CAT scans, MRIs, and ultrasounds can't show us how much scar tissue there is.
And one last question, why is that scar tissue so important to keep track of?
It's important because scar tissue, when it gets bad, people get cirrhosis, and they can have complications like liver cancer, which is very important to screen with an ultrasound for, or do endoscopies to make sure that they don't have varicose veins in their esophagus and bleed from.
So this can help keep liver disease from progressing. You can at least keep track of it a lot more efficiently with this new machine. That sounds terrific. Great information from Dr. Michael Einstein of Hartford Hospital. Thanks for being with us tonight, and thanks for your insight. Now, if you have questions for Dr. Einstein, he is available right now, live online in our web chat. So take advantage of this. Just go to our website, WFSB.com.